Well, 1 year after the World Health Organization declared Nigeria polio-free, the nation is now battling another form of polio. Health officials say over 100 cases of circulating vaccine-derived poliovirus type 2 have been detected in Nigeria since last year. Correspondent Phil Ihaza reports from Abuja.
One of the last polio vaccination exercises in 2019, before Nigeria was declared free of the wild poliovirus in August 2020. A year down the road, authorities are intensifying efforts to contain circulating vaccine-derived poliovirus type 2 detected in some parts of the country.
Yes, technically speaking, it came from a weakened poliovirus that is in the environment. But if a child is vaccinated against all types of poliovirus, whether it's under routine immunizations or whether it's during the campaign, they won't get it. So we have this problem because of low routine immunizations coverage, and because during the campaign maybe not enough children are being vaccinated.
And this is blamed on the COVID-19 pandemic lockdown last year, which disrupted routine immunization campaigns for polio, coupled with challenges of poor access to rural communities and insecurity. Polio is a viral disease that affects the nervous system and can cause paralysis if people are not vaccinated as infants. The UN says the polio-free status of the country is not affected since it's not the wild poliovirus, and in collaboration with the government and other partners, there is a high response to tackling this new outbreak already.
The GPI and leaders of African governments are committed to stopping the outbreaks. The governments restarted vaccination, as I mentioned, in July 2020, and are implementing new tools and tactics to better reach every child with polio vaccines to ensure high population immunity as part of a new strategy. Because currently, the level of immunity of our children to most childhood diseases, including polio, are hovering around 50% and in some cases much less.
The Nigerian government says it is also moving to address the problem of low infrastructure and insecurity seriously so that health workers can easily access affected regions. And those efforts have started to pay off.
Since March 2021, we have been conducting outbreak response in the various states that have been impacted by this outbreak of vaccines-derived poliovirus. Last week, we've just completed an outbreak response in several states, including FCT, Adamawa, Plateau, Kaduna, and Nasarawa.
The focus is on children less than 5 years.
Authorities say they are optimistic that with ongoing efforts in partnership with organizations like UNICEF, there will be no polio case by the end of the year. That could ensure a more healthy and productive population for Nigeria, both now and in the future. Phil Ihaza, CGTN, Abuja.